Welcome to the No Limits podcast, where breakthrough strategies in therapeutic education help neurodivergent children learn, connect, and grow in powerful new ways.
Hi, and welcome to the No Limits podcast. This week is the part of the series of the CDC Plus, which is the Consumer Directed Care Plus for Florida. So we're going to get started on what it is. CDC Plus, Consumer Directed Care Plus, is a Florida Medicaid Waiver service delivery model that gives families control over how their child's approved Medicaid waiver funds are used. Instead of services being managed and scheduled by traditional agencies, parents or legal guardians become those decision makers and employers, customizing care fitting their child's real life. And that's what I love about this program. Under the CDC Plus, families may direct how waiver dollars are spent. This gives you more direct access to the things that you want to do. Hire and manage caregivers, including some family members. So this does not say that you have to go to an actual large corporation to receive services. You can schedule, hire, fire these people that work for you. Setting schedules that work for home, school, and community life is incredibly important for our kids. Purchase approved service supports and supplies as you need them, instead of being sent to your house in large bulk. Build a team based on your child's needs and not the provider's availability. It's driven by the support plan, the QSI, and the SANS. CDC Plus is available to individuals enrolled in the Florida Developmental Disability Medicaid waivers, including the iBudget waiver and the Family Care Council related waivers, children and adults with qualifying developmental disabilities, which I went over in podcast number 2. Eligibility requirements. You have to be waiver enrolled, and you have to create a person-centered support plan. You also have to get approval by your regional waiver office for the services that you would have under your person-centered support plan, which also includes the QSI and the SANS. How CDC Plus is managed. The family works with the CDC Plus consultant and then also with a fiscal employer agent that handles the payroll and the tax filings while you do the CDC Plus. The parent directs care and Medicaid pays approved cost, which would be in your cost plan. CDC Plus does not increase funding, it changes who controls it, which is what I love about it. You can actually have it tailored to your child's life. What CDC Plus and Medicaid does, it does not eliminate Medicaid rules. So what are the laws or the rules for Medicaid inside? The law is, it is legally required to prevent deterioration, slow progress, and preserve function of your children. This is incredibly important because a lot of people don't understand that. This is not maintenance. It is actually keeping your child from becoming more disabled. Under 42 United States Constitution, Medicaid must cover services that are necessary to correct or ameliorate, which means make better, a physical and mental condition in children under the age of 21. It does not remove medical necessity requirements, which are important and they would be justified by your physicians or your therapist. CDC operates under the Florida Agencies for Persons with Disabilities in partnership with the Florida Agency for Healthcare Administration. The Medically Fragile Children's Waiver supports children with complex medical conditions requiring ongoing skilled nursing and intensive medical care to safely remain in home. The purpose is always the same: to prevent hospitalizations or institutional placements by providing medical supports in community settings And again, that's what the waivers are. They're trying to keep children and adults out of nursing homes and institutional care. The Medically Fragile Children's Waiver, or MFC for short, waiver is a Florida Medicaid waiver designed for children under the age of 21 who have complex, life-sustaining medical conditions that would otherwise require hospitals or nursing facility level care. This would be a more intensive type of waiver that will have more wraparound services, and basically it is the only medical-based waiver that doesn't include the function of the child. Instead of institutionalization, the waiver allows Medicaid funds to be used to support the child at home, in the community, and when appropriate, at schools with intensive medical services. So who the MFC waiver serves is children who are medically depending, meaning they rely on ongoing medical care to survive, such as, and not all of these are included, ventilator or respiratory support, tracheostomy care, feeding tubes, G-tubes, J-tubes, TPN, seizure disorders requiring constant monitoring or intense medication, complex cardiac, neurological, or pulmonary care. Also, any child that has multiple medical technology uses daily, right? So that's really important if there's a lot of equipment that's coming with them. Eligibility is based on medical fragility, not developmental diagnosis alone, which is very important. What makes the MFC waiver different is that unlike developmental disability waivers, the MFC waiver is medical model. Like I said before, it's driven differently than the other waivers. It requires hospital level medical necessity, right? So you have to have authorization from your doctor. You need to authorize private duty nursing hours. It's focused on the medical stability and safety. It coordinates closely with physicians, hospitals, and DME providers so that the child is able to sustain in a home or community environment. That doesn't keep them out of the community. It just says there needs to be more wraparound supports. Services commonly covered are private duty nursing, skilled nursing visits, if that is applicable, medical equipment and supplies, respiratory therapist, care coordination and case management, and some therapies when medically necessary. This waiver is administered through the Florida Agency for Healthcare Administration, or AHCA, and not APD. Why does this even matter? Its eligibility pathways are different because it's based on medical. Assessment tools are medical, not the QSI or the SANS. And budgets are tied to physician's orders and the care plan. So why is this very important? This waiver is for the most complex of the complex children that the waivers provide. I know that this is a lot of information over the last few times that I've done this podcast, and I invite you to contact me, reach out to me if you have any questions about the Medicaid waivers. I have been on the Medicaid waivers for almost 2 decades now and understand them completely. I was there when Jeb Bush was initially putting this into law, when our governor of our state, and I understand that parents have difficulty navigating these systems. I'm always open to speak to someone or also give advice about what's happening in our Florida Medicaid systems, because I want to empower parents to do the very best for their kids. Thank you for being here today at the No Limits podcast. I always appreciate a good follow, subscribe, like us so that we can get more parents to understand what their kids can do.